When it comes to health equity, I like to think about the health disparities and why certain groups in the population do not have the same access to healthcare as others. Specifically, I would like to talk about immigrant communities like the Vietnamese community. For the Vietnamese community, an example of a health equity issue they have is hepatitis B. According to Chu et al. 2016, Vietnamese Americans have an exposure rate of 83.3% to HPV compared to 3.8% of the general population. The paper also found that according to the CDC, one of the factors why there is a high exposure rate in the Vietnamese immigrant community is that Vietnam's an endemic area of hepatitis B. In terms of screening and vaccination, the paper found about a 60.2% screening rate and a 34.7% vaccination rate for Vietnamese Americans, which is very low compared to how many that are exposed. Now, a 2013 paper from one of my mentors, Dr. Connie Nguyen Trong, found that some of the reasons why there's a low screening and vaccination rate among Vietnamese Americans is lack of access to a primary care physician and lack of knowledge about the disease. Now, therefore, a solution that I am advocating for is to expand COM, which is the emergency Medicaid program that many Vietnamese Americans who are recent immigrants have, to a level more like regular Medicaid. With this expansion, I would advocate for preventative services like screenings and vaccinations, but also having a portion of the money to fund programs to educate the community about the disease. Dr. Nguyen Truong's 2013 paper also supports this by highlighting an important point that if we have community social workers integrating in areas with a high proportion of Vietnamese Americans, combined with giving them access to screenings and vaccinations like through a primary care provider, more Vietnamese Americans will be aware of HPV and sign up for said screenings and vaccinations. Thank you.